Hello and welcome back to GP Video Podcast by Nadia. So today I would like to tell you about the similarities and differences between two types of arthritis, rheumatoid arthritis and osteoarthritis. These two are the most common forms of arthritis. What is arthritis? Arthritis is inflammation of the joints. I'm sure you all have heard these two names. Either we have suffered from them or we have seen people around us who are suffering from them. So we should know what is rheumatoid arthritis, what is osteoarthritis, what are the similarities, and what are the distinguishing features. So rheumatoid arthritis and osteoarthritis are two different types of arthritis. So the first commonality between them is that both are arthritis, but they are two different types. They share some similar characteristics, but each has different set of symptoms. And the most important bit is each requires different type of treatment. So an accurate diagnosis is very, very important. Osteoarthritis is the most common form of arthritis. Rheumatoid arthritis affects about 1/10 as many people as osteoarthritis. The main difference between osteoarthritis and rheumatoid arthritis is the cause behind the joint symptoms or is the cause behind this arthritis. Osteoarthritis is caused by mechanical wear and tear of joints, while rheumatoid arthritis is an autoimmune disease in which the body's own immune system attacks the body's joints. So see, this is the most important and the most not only the most important, but the cause that is very evident, not only by the name but by the causality as well. So osteoarthritis is the wear and tear of the joints, while rheumatoid arthritis is an autoimmune disease in which the body's own immune system attacks the joints. So what is arthritis? Arthritis is the disease or the inflammation of the joints. Two main types, osteoarthritis, rheumatoid arthritis. Osteoarthritis is usually the wear and tear of the joints itself, while rheumatoid arthritis is the autoimmune disease in which the body's own immune system attacks the joints. Now, what are the other characteristics or what are the other differences? Age at which the condition starts. So what is the age at which these conditions can start? So with osteoarthritis, as the name suggests, wear and tear, so it usually begins later in life. So we can also say that osteoarthritis is a middle age or old age disease, while rheumatoid arthritis can begin any time in life, usually between 30 years and 50 years. It can even happen earlier, but it can happen any time in life. But osteoarthritis is the disease of old age, like typically. Now, number two characteristic is a speed of onset. Osteoarthritis, because it is wear and tear of joints, it is slow in onset and it develops over years, while rheumatoid arthritis is relatively rapid over weeks to months. Now, what are the joint symptoms? In osteoarthritis, joints ache and may be tender, but have little or no swelling. So they are tender, they ache, but there is no swelling. While in rheumatoid arthritis, joints are not only painful, they are swollen and stiff. Because again, it is an autoimmune disease causing a lot of inflammation. So joints are painful, swollen, and stiff. Now, pattern of joints that are affected. So in osteoarthritis, symptoms often begin on one side of the body and may spread to the other side. So for example, if it starts in one knee of the body, then if for example it starts on right knee, it will go to the left knee as well, but usually it starts on one side of the body. Symptoms begin gradually and are often limited to one set of joints. Usually the finger joints closest to the fingernails or distal interphalangeal joints or the thumbs, large weight-bearing joints like hips and knees or the spine. So these are all very self-explainable because because it is wear and tear of the joints, so the large joints are affected by it because our knees and our hips bear most of our weight, so they go through most of the wear and tear. So they are involved. Then the finger joints closest to the fingernails, which are DIPs, or the thumb, which is again the distal interphalangeal joints, or large weight bearing joints, or the spine, because again the spine bears our weight. So, and it usually starts on one side of the body but may spread to the other side of the body eventually as well. While in rheumatoid arthritis, it often affects small and large joints on both sides of the body, symmetrical. So rheumatoid arthritis is symmetrical, while osteoarthritis is usually asymmetrical. So rheumatoid arthritis will affect both hands, both wrists or elbows, or the balls of both feet. So these are just the examples, but what was the main important point here is they both involve both small joints and large joints, but usually osteoarthritis starts on one side of the body, while rheumatoid arthritis, if it involves one set of joints, it involves that set of joint on both sides of the body. Now, morning stiffness. Morning stiffness is more pronounced in rheumatoid arthritis, and it usually lasts longer than 1 hour. While morning stiffness is usually not the hallmark of osteoarthritis, while it can occur, but to a very lesser extent, and usually lasts much lesser than 1 hour. In fact, stiffness returns at the end of the day or after periods of activity. So you can differentiate between rheumatoid arthritis and osteoarthritis in the terms that rheumatoid arthritis, the symptoms are worse in the morning and they ease by the day, while osteoarthritis, symptoms are worse by the end of the day or by the end of the periods of activity. Again, very, very, very evident, again, very, very, very clear, again, very, very, very self-explanatory that osteoarthritis, because it's the wear and tear of the joints, of course, it will be bad or it will be worse while you're using the joints, while rheumatoid arthritis is the inflammation of the joints, is the autoimmune inflammation of the joint. So it is basically morning stiffness is much more important, and it lasts usually longer than 1 hour. Presence of symptoms affecting the whole body, or are there any systemic symptoms? Yes, there are systemic symptoms in rheumatoid arthritis because, again, as you remember, it is an autoimmune inflammatory condition, frequent fatigue, and a general feeling of being ill, sometimes fever, sometimes feeling very tired, and all are present, while whole body symptoms are not present in osteoarthritis. So again, summarizing, one, osteoarthritis is wear and tear, while rheumatoid arthritis is the inflammation, autoimmune inflammation. There are systemic symptoms present in rheumatoid arthritis, generalized fatigue, swollen joints, painful and tender and stiff, and generally feeling ill, while in osteoarthritis, joints ache and may be tender, but they have little or no swelling and no fevers, no fatigue. Pattern of joints affected, symmetrical, which is on both sides in rheumatoid arthritis, while osteoarthritis, it's usually asymmetrical or starts on one side of the body. Morning stiffness is the hallmark of rheumatoid arthritis, while in osteoarthritis, joints ache more at the end of the day. And osteoarthritis is much more common than rheumatoid arthritis. So that was all about rheumatoid arthritis and osteoarthritis today. I will some other time I will talk about their respective treatments as well.